Hello, and welcome to a Health Podyssey. I'm your host, Rob Lott. This April at Health Affairs, we're all about food, nutrition, and health. That's the subject of our new theme issue, a veritable smorgasbord of important research examining the public investments and policies that really underpin some of the most innovative diet and lifestyle interventions aimed at things like improving access to healthy, safe, and affordable food, eradicating hunger, and reducing health disparities. One of those innovative interventions is medically tailored meals, in which programs acting on a referral of a medical professional prepare and deliver nutritionist-designed meals to people with complex health conditions and high acuity care. Such meals have been shown to improve patients' health in some cases, but we've also got a lot more to learn about their impact on healthcare use and spending. That's the subject of today's Health Podyssey. I'm here with Amy Deng, a PhD candidate at Tufts University's Friedman School of Nutrition Science and Policy. She's the lead author on a new paper from this month's issue that attempts to envision and quantify what the future might hold for this kind of intervention. Its title is, quote, Estimated Impact of Medically Tailored Meals on Healthcare Use and Expenditures in 50 U.S. States. And so let's just dig in here. Amy Deng, welcome to a Health Podyssey.
Hi, thank you for having me.
Awesome. So let's just start with some background. Can you describe a typical medically tailored meal program? Who runs something like this? What are the typical patients and what's their experience like?
So medically tailored meal programs typically are run by nonprofit organizations, hospitals, or community-based groups. They usually provide nutritionally tailored meal designed by registered dietitian, and those meals are specially provided for the needs of individuals with dietary-sensitive chronic disease like diabetes, heart disease, HIV, cancer, or kidney disease. And typically, those patients are severely ill and often experience food security and unable to consistently access the nutritious food themselves.
And do you have a sense of how widespread this intervention is? Can most patients who need it find one in their neighborhood?
So I think currently medically tailored meal programs have expanded considerably across the U.S. and especially in recent years. And I think they're most established in large urban centers like places in New York City, San Francisco, Boston, and Los Angeles. But the availability is lower in rural, less populous area.
Do you have a sense of how effective medically tailored meals are as an intervention? How good are they at reducing healthcare utilization or spending, improving people's health? What's the evidence base out there?
Previously, a lot of studies have shown medically tailored meal programs are highly effective. They consistently reduce hospital admission, emergency room visits, healthcare costs, and for the coverage of high-risk population. For example, medically tailored meal intervention have been associated with about 16% fewer hospitalizations.
And how common is it for something like medically tailored meals to be covered by someone's health insurance policy?
So I think right now, the health insurance are not that commonly cover medically tailored meal, but this starting to change. Coverage usually happens through special program like Section 1115 Medicaid waivers, which allows states to test the innovative health approach like medically tailored meals. And for example, states like Massachusetts, California, and others have already adopted those waivers. And additionally, some Medicare Advantage plans and private insurance are beginning to offer medically tailored meals because they recognize their potential to save money and improve patient health.
Okay, so against this backdrop, you conducted a study with your co-authors that basically asks, correct me if I'm wrong here, what if everyone who could benefit from or was eligible to receive medically tailored meals, what if they got them? And what did your study find?
So our research shown that if everyone who can benefit from medically tailored meals actually receive them, we find 49 states have cost saving, with Connecticut, Pennsylvania, and Massachusetts seeing the highest saving per person. And only one state, Alabama, showing cost neutral. And we also find providing this meal across U.S. nationally can save around $32 billion each year, or to be precise, in the first year. For hospitalization, we find providing the medically tailored meal in the first year can save around 3.5 million hospitalization each year nationally.
Wow, that's a pretty big number. When you say savings, just to clarify, you're basically comparing the cost of implementing the program, paying for the food, paying the providers running the program, less the savings from better health, less cost expenditures. Is that a fair interpretation?
That's correct. That's the net cost saving, which already subtract the fees for like paying the meal and dietitian screening.
And it sounds like you described there's a fair amount of variation from state to state. So in one state, there's a significant cost effectiveness. In, I think you said it was Alabama, it's less so. What explains that discrepancy?
I think there are several drivers for the variation. First, the eligible population size, because states differ in demographic and the number of people who qualify for the program. So that's one driver. And the other is the baseline healthcare costs and the hospitalization rate. In some states, like where the healthcare is more expensive, like Connecticut, Pennsylvania, and Massachusetts, there are more room to reduce costs and hospital use. And for states like Alabama, the baseline healthcare cost is not as high as like in the states in the Northeast region. In addition to those two, I think the key driver is the state-specific healthcare system. Some states, like for example Maryland, have a unique payment model. For example, Maryland's global hospital budget system already control costs in a different way. So in Maryland, we can find a different result.
Gotcha. So essentially in states where cost is maybe a little more high, where prices are higher, where cost is not as under control, there's greater potential for savings from a program like this.
Mm-hmm.
Well, I have a lot more to ask about the model. It sounds really promising, but let's first take a quick break. And we're back. I'm here talking with Amy Deng, a PhD candidate at Tufts Friedman School of Nutrition Science, all about a paper in the April issue of Health Affairs in which she and her co-authors estimated the impact of medically tailored meals. Can you talk a little bit about your time frame as well in the study? I think you looked at outcomes after 1 year and then again at the 5-year mark. Why did you choose those points? And what did you see in terms of a difference between those 2 points?
That's a great question. We choose to model both 1 year and 5 year outcome to measure both the short term and long term impact of the intervention. The 1 year are mainly to show the immediate effect, like reducing hospitalization and cost saving, which are important for decision maker who want to see a quick result. But we also look at the 5-year outcome because many policies, especially at the states or federal level, are planned and budgeted over multiple year cycles, often around 5 years. So that's why we choose this time frame as well. And we are not extending the year for even longer because that may, I think, compromise the accuracy of our result.
Fair enough. Now, this was a simulation, which is sort of the whole point, right? To imagine what's possible and attempt to quantify it. But what if a policymaker came to you, for example, and said, this is all well and good. Now go ahead and generate some real world evidence. And let's also say they maybe give you a blank check to fund that research. Where would you start? What's next? What are the questions in this space that really haven't yet been answered?
Yeah, thank you for this question. It's a great question and exciting because it's showing the future potential research. And I think the next steps is because I understand the simulation like ours help only paint the big picture of what's possible. And but I do acknowledge further real world research can fill in the details and further guide the implementation policy. If I have a blank check, I could start with a large multi-states random control trial of medically tailored meals. I would follow patients over several years and track healthcare use and spending, and even include different populations like Medicaid, Medicare Advantage, and dual eligible individual to see how medically tailored meals perform in different insurance and healthcare system contexts. And in addition, I would also want to look at who could benefit the most and whether those effects differ by race, disability status, different disability status, and geography, and further more groups. So the next steps, there are a few key questions I want to maybe ask here for future research potential. For example, I would like to see what is the optimal dose of medically tailored meals, like how many meals over what period for what type of conditions. That's one question. And the other is what happens when medically tailored meals are paired with other support like nutrition counseling, SNAP benefits, or different care coordinations. So that's the two questions I have in my mind, but there is a lot of more to explore.
Wow, so that's a great agenda. So what's your sort of final takeaway or your next big step?
The final takeaway is medically tailored meal can prevent hospitalization and create cost saving for 49 states. And although we know medically tailored meal works, but we want to future to make more efforts to make them more available, make this intervention or medically tailored meals become a routine part of healthcare. And to do that, we need more real-world evidence studies like random control trial to show how to implement them well for people in need.
Well, that's a great agenda for the road ahead and a great spot perhaps to wrap up. Amy, Deng, thank you so much for taking the time to chat with us and to tell us all about your paper in the April issue of Health Affairs.
Yeah, thank you. Thank you for having me.
It was great to talk to you. This was wonderful. To our listeners, if you enjoyed this episode, please tune in again next week. Tell a friend, smash that subscribe button. And until then, have a good week.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about the Health Podyssey.